add to you.
Hello, everybody. Welcome to the third episode of Perth is Beautiful. And today we have got young RN Chloe joining us as a guest. And I thought it would be a good idea to have an upcoming RN who wants to join the cosmetic industry to come and have a chat on this podcast because Chloe is a friend of one of my friends and she approached us wanting some information about how to get into cosmetic industry. Particularly cosmetic injecting. So here we are. So Chloe, how are you doing?
Good, how are you?
Very well. Tell me about yourself, a little bit about yourself. First of all, where are you from?
So I'm originally from South Africa, Durban. As you were saying, I am a registered nurse at the moment, currently studying in the cosmetics industry.
Yep. Okay. So what are you studying and where are you studying?
So I'm studying cosmetic nursing and injectables,
Yeah.
and I'm currently studying with the Australian Academy of Cosmetic and Dermal Science.
Okay. So that's a Perth-based organization, isn't it?
Yes, that's correct.
Yep. Over the years, we have had few graduates from that institute, and I think they're doing a good job.
That's great.
How are you finding the training there and the course there? Can you give me some feedback about that?
Yeah, I'm loving it. I'm finding that they really share a lot of information. It is very detailed. It's a lot more detailed than I thought. The integumentary system is very hard, but I am enjoying it.
Okay, good. Because once you've got a solid foundation, I think it is then easier to build your clinical career
Yeah,
in a better way.
yeah, for sure.
So have you actually done any hands-on training or mostly it's theory at the moment?
Mostly theory at the moment, yeah.
Okay, well, you're welcome to ask me any questions about the practical side of things or clinical application of what you are learning.
Perfect.
So basically the cosmetic industry for nurses is predominantly around cosmetic injecting. So we have got anti-wrinkle injections, we've got dermal fillers, we've got platelet-rich plasma, we've got fat-dissolving injections, and there are a couple of other things which can then be added on. But the bread and butter has to be these couple of treatments that I just mentioned.
Yeah.
It's a very exciting industry. It is challenging as well. You have to be on top of your game.
Yeah.
You cannot be a mediocre or an average person.
Yeah, for sure.
Like anything else in today's world, if you are good at what you do, you will be successful. You need to be passionate about it as well. Okay?
Yeah,
And you have to give it time and some dedication as well.
for sure.
Over the years, I have seen a lot of nurses coming and joining the cosmetic industry. I have found out with my experience of mentoring a lot of nurses over the years and seeing their careers progress. The nurses who join cosmetic industry as injectors, they usually fall into two distinct categories. Ones who are what we call the gun injectors. So they are at the top of their game.
Yeah.
They get full time very quickly.
Yeah.
Their client retention is very good. Their injecting skills are very good. Their people skills are very good. And they've got very good social media following. So they have got good presence on social media such as Instagram, TikTok these days as well. Back in the day, it used to be Facebook.
Yeah.
But mostly it is now the Instagram. So with that in mind, that group of nurses are highly sought after in the industry and they make really good careers for themselves.
Yeah.
On the other hand, we have got cosmetic injectors who always stay part-time. Okay.
Yeah.
So it doesn't mean that they're not good. It just means that either their lifestyle or priorities are different,
Yeah.
or they enjoy their work in hospital system or public system as much as they do as in cosmetic injecting.
Yeah.
So, but often what happens is that they usually, because they are part-time, they never are able to get the same kind of traction and patient bookings
Yeah.
that the full-time nurses who are working in the industry
Yeah.
full-time. So where do you see yourself? Do you see yourself as a part-time injector or as a full-time injector?
I see myself as a full-time injector. I would definitely pursue this career in the
Okay.
long run. Yeah.
Excellent. So then you understand that to be a full-time injector, you have to be dedicated and passionate about it. Also, obviously, you need to have the skill set to go with it as well, because dedication and passion alone without the skill set is not going to get you far.
Yeah.
Got it?
Yeah.
So this natural talent of injecting comes naturally. Over the years, I've trained a lot of nurses who were passionate, wanted to do well, but their injecting skills were not fine enough. And no matter how much we trained them, they just naturally didn't have that the hand-muscle coordination and
Yeah.
fine injecting technique. So similarly, I've seen a lot of doctors like that as well, who wanted to be doing well in cosmetics, but they could never become either full-time cosmetic doctors or develop the kind of
Yeah.
client retention as well. In our industry, the most important thing is building a long-term relationship and rapport with your patient.
Yeah.
And once you're able to do that, then they trust you. And once they trust you, they will come back.
Yeah. 100%.
Got it? So do you think you have what it takes to be able to do that?
I want to hope so.
Okay. So in hospital nursing, are you doing any hospital work at the moment?
Not at the moment. I'm working in a radiology department at the moment,
Okay.
but I was in the public hospital industry.
Okay. So in the radiology, it's a very completely different field. The one thing I tell all junior doctors and nurses coming in cosmetic medicine or wanting to join the field is that our customers or our patients, I should call patients, not customers, because some of my senior colleagues don't like that. So our patients do not need us, okay? They want us.
Yeah.
So the difference between a need and a want is there. No one is going to die if their wrinkle relaxers are gone and they've got some visible crow's feet,
Yeah.
correct? Whereas in radiology, it can be life-threatening situation that needs to be diagnosed. Similarly, so the mindset of a clinician in mainstream medicine versus cosmetic medicine is that we have to be a lot better in our customer service. There is no Medicare rebates applicable.
Yeah. No.
Yeah, the one thing I want to tell you is that Medicare does not cover any cosmetic treatments.
Right.
Okay. There are some cheeky clinics that use Medicare item numbers.
Really?
Yeah, they do.
Oh my gosh.
But they shouldn't,
Yeah.
because that falls under Medicare fraud.
Yeah.
Yeah. So, but anyway, most ethical doctors and nurses, they don't do that. But sometimes we do hear about clinics that are charging Medicare item numbers, which they shouldn't be doing. But I'm sure Medicare knows that and is on to that, so we don't have to worry about that. Do you have any questions that you want to ask me specifically about when you wanted to have a chat with me? And so I'll put the ball in your court.
All right. Yeah, I'd actually like to know, because I am such a new graduate nurse, especially with no experience in the cosmetic industry, wanting to go down that path, what advice would you give for someone who's just starting out new?
Okay, so this is a question I get asked all the time. The other day we had Dr. Lily Smith. She asked me the same question. So my advice would be to initially, because you're already a nurse, you already know your basic nursing. So under Australian law, you're allowed to do injecting as long as there is a supervising doctor who is supervising you and is prescribing the medication for you. So just remember that always have your prescribing doctor with you, because if you're not doing it, then you're not following the law.
Yeah.
So once that is done, when it comes to starting off in injecting, I do not see anyone going straight into cosmetic injecting unless they are really, really, really talented or super, super skilled. Normally there's a little transition where while you're working in your main job, like in your case is radiology, you start doing 1 or 2 days after your training in cosmetics and slowly build your client base and then slowly transition from mainstream medicine into cosmetic. Yeah. Initially, when we are treating young doctors and nurses in cosmetic injecting, they are very much focused on the skill, like how to draw anti-wrinkle injections, how to dilute them, where to inject them, how much to inject them, what units, and they even come and look at, like I did the same thing. They even look at the syringes and where to get the syringes from and things like that,
Yeah.
which is natural progression. So initially you'll find yourself doing that. But I would also want you to not only just focus on injecting skills, but also focus on your people skills at the same time,
Yeah.
and have your customer service as a priority as well. So be nice, be kind, be smiling all the time.
Of course.
You naturally are a smiley person, so I
Thank
can
you.
see that. So that will go well. And create a lot of content. I know it may sound like a strange thing to say, but the injectors in today's world who create a lot of content of what they're doing and post it, they tend to get more following, and then people see them as industry leaders or as more experienced.
Yeah.
Whereas those injectors who are not very visible on social media, unfortunately, people don't know that they are there.
Yeah, exactly.
So you need to, from day one, you need to have good before and after photos of your work.
Yeah.
And try to make small videos of what you're doing. Read the current medical guidelines as well, the TGA guidelines and APRA guidelines. Read that and then do your marketing according to that. Recently, there's a lot more restrictions on medical professionals, how we market our services as well.
Right.
And every now and then we do get a letter from either TGA or sometime from APRA about marketing guidelines. So the best thing is to make yourself familiar with that and try your best not to breach any of that.
Yeah. No,
Got it?
Of course.
So the answer to your question is, first focus on your injecting skills, get as much practical experience as possible. And once you've done that, then you can slowly increase your skill set by doing more complicated things such as advanced dermal fillers, and other treatments such as PDO threads, PRP injections, things like that.
Right.
Got it?
Yeah.
But give it time. You cannot rush it. I see some nurses who like to know everything within a couple of days,
Yeah.
which is fine. We can actually treat them basic indications of anti-wrinkle injections within a few days.
Yeah.
But to get that experience and skill set where you are doing it effectively takes months, if not years. Like I remember when I started, looking back, I think that by the time it was my second or third year that I was competent enough to be doing those things.
Right.
The first year I was just doing it what I learned, and I just sort of did a bit of rota learning, and I was just, before seeing every patient, I would then go and quickly watch a video and open my textbook and make sure that my dosing is fine. But then it becomes a natural process, and then you don't need to memorize anything. It just comes naturally.
Yeah. Well, I don't think there's a problem with that, because I'd feel more safe being in the hands of someone who wants to make sure that they do their work well instead of winging it.
Yeah, exactly. You'll be surprised that in our clinics, we do not allow nurses to touch our patients unless I am fully satisfied of their skill set.
Yeah.
And sometimes that can take a year. Sometimes it can take up to 2 years. We have got a very, very good nurse at the moment who is almost with us for 2 years, but I am only just allowed them to start injecting under supervision.
Yeah.
So there's a thorough training that I like to do. We have hired in the past nurses who were fully trained, at least on their CV, they told us they're fully trained.
Yeah.
And they told us that they were doing advanced injecting. But when I saw their skill set, I thought, not sure about that, But then in some other clinics, such as chain clinics, like corporate clinics, they are like fully fledged senior nurses.
Right.
Whereas when they come and see us and we assess them, they are not.
Well, at least when people come to your clinic, they'll know they're getting the best from the best.
We hope so. That's what we hope for, aim for. But that's the difference between a boutique cosmetic practice and versus a chain clinic, because the people who own those clinics, they are not medical professionals. They're just businessmen who have decided that this is a good way to make money.
Yeah.
So they are not really vested into what are they doing. Their bottom line is just to make profit.
Yeah.
Whereas for us as clinicians, I have to make sure that this is my name and reputation online, not just a quick profit.
Yeah.
So we have to make sure that we do our best. Of course, we are human beings. We can make mistakes. We cannot make everyone 100% happy. Some people can develop adverse outcomes. Some people may feel that they didn't get the best customer service.
Yeah.
That happens because we are a busy practice and we are not absolutely flawless. But other than that, we have a very good name and reputation in the industry, and we like to improve it by improving. We constantly like to improve it by improving our sort of protocols, policies, and how we interact with the patients.
And that's fantastic.
Good.
It's really good. So you've
Thank
built
you.
such a successful company. I want to know how it started. Where did this start in your, I want to say, studying?
Okay, so again, the answer to your question is pretty long. I think it will take us about an hour to answer that question. But in a summary, I can tell you that in around 2007 and 8, I found out about cosmetic medicine as a field. And then I was lucky, I was in Sydney at the time, and I met a few doctors who were already working in cosmetic industry. So from there, I found out that this is something that I could do. And I gave it a try, and I found myself that it was pretty good. I was good naturally at it.
Yeah.
My injecting skills were really good. My people skills were good. People were able to build a rapport with me quickly.
Good, yeah.
And then I was able to do the right thing. So you only find that out when you do your first batch of patients, and then they come back and they give you a feedback, and they're very happy with your work. Some may not be as happy because you're just starting out. So, but you do tell them that this is something that you're training. So always tell your patient in the beginning that you are a new injector, and that it's good to be honest in the beginning.
Yeah.
And but whoever employs you, they should be able to sort of give you the advice as to when you are able to then start injecting. So start with basics first and then go from there.
That's great.
Cool.
Yeah, thank you for that.
You're welcome. All right, guys. So thanks a lot for Chloe. Thanks a lot for coming as a guest today. And this was basically just a little summary of the initial conversations we have when an injecting nurse or cosmetic nurse who is starting out new comes to us for either a job interview or applies for a training position. So I hope this conversation is going to be helpful and will give some more insight into the cosmetic industry for nurses. And hopefully we'll see you again with our 4th podcast soon. Thank you.